So before I get started, a couple disclaimers. I am not an immunologist. I'm lucky enough to have folks to bounce problems off that are. So don't hold that against. We are not going to go real deep into immunology today, but I am going to touch on a little bit. The other thing I am not is a vaccinologist. So I am coming in front of you really from the perspective of a practitioner. I consider myself still a practitioner of veterinary medicine, even though I'm at the university working in extension. And so hopefully coming at you from that perspective to stimulate some thought about decisions you're making for the vaccination in your herds, and why you're making those decisions, and maybe how you can more effectively make those decisions going forward. Okay, so even with that disclaimer, when we talk about the immune system in the bovine, right, we are generally speaking, when we teach students about the immune system, we're talking about three different essentially arms of immunity. That passive immunity, which we'll touch on a little bit today, because I think it's an important part of the picture. Innate immunity, which we are not going to talk a whole lot about today, and then what really we seem to kind of focus on when we talk about vaccination is that acquired immunity. So that immunity that we can use tools in our toolbox to enhance or build to help protect our herds against disease. I put this graphic up not because we're going to go deep into the immune system, but just to point out that even though we think about these as three separate entities, those three arms of the immune system are very interconnected. And everything we do targeted at one portion of the immune system has unintended consequences in other parts of the immune system, or maybe intended consequences. But understand that every time we pull a thread on the immune system, we may get the result we want, but we also are going to see other things that we may or may not anticipate. Okay, a quick vaccine review for folks that we're gonna really talk about in the context of reproductive vaccines. A lot of the discussion is around those vaccines that we consider killed vaccines, right, and those modified live viral vaccines. So you've probably had those discussions with your veterinarian, hopefully. So those are not unfamiliar terms to you, but important things to keep in mind when we're talking about the context of killed vaccines, right? They contain antigens of interest, but they don't contain any live viral or bacterial material, bacterial isolates. So those vaccines have to utilize some different approaches to stimulate the immune system. We'll talk about things like adjuvants, which are other chemicals added to those vaccines to really basically turn on that immune system and say, hey, there's something here you need to be interested in. Come look at this. So that's an important component of killed vaccines. Generally speaking, when we talk about reproductive vaccines, right, these are probably the vaccines that you have considered safe, right, quote unquote safe vaccines for those pregnant animals. So that's a lot of times what folks' exposure to those are. Modified live vaccines, on the other hand, contain particularly some live viral. Obviously, they are not wild type or the pathogen, the infection-inducing viral isolates that we think of in an actual disease process. They have been changed in some way. They've been attenuated, so they're less virulent, less able to cause disease. But keep in mind that when we're using a modified live viral vaccine, what we are doing is setting up a low-level infection. That's our goal, because that low-level infection is what signals to the immune system, hey, come look at this, it's important. So a lot of times when we talk about these, or when we hear folks talk about them, we talk about modified live vaccines as being more like a natural infection, right? They show up in the same places. Those attenuated viruses act very much like viruses. So when the immune system, quote unquote, gets a look at those, it's looking at something that more closely mimics a natural infection. All right, so with that, Baseline, getting everybody kind of on the same page. My goal for today is to hopefully challenge some perception how to approach vaccination as a professional development program for that reproductive animal in your herd. We want to take some deliberate steps to foster a lifelong immunity to the pathogens of interest, right? Be less concerned about what can I do with this vaccine today for this breeding season, and think about what the lifetime of that cow might look like, and ultimately establish some resiliency in that herd, right? We're not going to say that they won't ever be exposed to those pathogens, but what can we do to set up that cow herd when they are exposed to be resilient to that challenge? All right, so scattered through here, there's a couple paradigm shift topics that I kind of want to throw out there. You guys are going to get a look at how my thought process works, and it's a little bit disorganized. But this is a paradigm that I was saddled with right out of vet school, right? We talked about if you're in doubt and it's not expensive, you should probably take the opportunity to vaccinate an animal, right? Does good things. I want to challenge that a little bit because as I've kind of talked to folks that are smarter than me, and as I've really thought about the metabolism and the physiology of that animal, just because vaccines are safe does not mean that they're necessarily benign. And what I mean by that is there is a cost to an immune response. And the animal doesn't care if that immune response is due to a vaccine that we put into the animal or an actual disease challenge that they are faced with, right? There's a really nice study out of Iowa State that did a single immune stimulatory LPS injection in Holstein calves, steer calves, and they quantified the glucose requirement that it took to mount that immune response. And over 12 hours, so it's 12 hours of a single immune stimulation event, they quantified 516 grams of dextrose was needed. So if we have any nutritionists in the room and you do the math on that, that's about 1,700 kilocalories or 1.7 megacalories, which doesn't sound like a lot until you consider that these were 370-pound calves, so they were not that large. And so me being curious and not a dairy nutritionist, I Google AI, what is the maintenance requirement of a 370-pound Holstein bull calf or steer calf? Google AI did the math and tells me that it's about 7.3 megacalories per day. So that makes that 1.7 megacalories look very different, right? That's a calf's maintenance requirements that are going to be pulled into that immune response. So I think we always need to keep in mind that even though vaccines are safe and useful tools, they're not benign. There's cost to using them. All right, so we're going to approach this from two different population perspectives. One of those is going to be the replacement heifer, and then we'll talk about the mature cow herd a little farther down the line. And so when about setting that replacement heifer up for long immune competency, these are the things I think about. The three big things that I kind of put in this bucket is colostrum, right? That start in life. We're going to talk a little bit about that. I know it's not a vaccine, but it's critical to the immune system. And then the next step in that calf's development is what do we do to that calf as a weaning age calf? How does that contribute to her ability to go into our reproductive pool and stay there for a long time? And finally, the piece that everybody thinks about, right, are those pre-breeding vaccination management tools that we reach for. So how many of you in the past have thought about, when I'm sorting replacement heifers at weaning, have I done what I need to do before this point to make her successful from a health standpoint? Most of us go in, right? I'm just as guilty as the next guy. Things get busy and the summer gets away from me, and then we wean calves, and I think, oh, I want to sort those off. Those are going to be my replacements, and I haven't even thought about what I've done to set them up for success. All right, so my thought process also goes through detours or rabbit trails, as we like to call them when we're working with students. So let's talk about colostrum just a little bit. Colostrum is foundational to the immune competence of any calf, right? You all have probably already been to seminars that talk about colostrum management, colostrum supplementation, how much do we need, what do we need, all of those things. But understand the reason that that comes up all the time is because that is the first step in the first 24 hours of life that tells me whether that calf has a chance at being successful, if that heifer is going to stay in for the duration. So calves that don't receive adequate colostrum are more likely to suffer illness, morbidity, and mortality or death during the first 6 months of life, right? That seems very logical. But keep in mind, it's really hard to put a heifer in my replacement pool if she died at 6 months of age. I don't care who her daddy is or how good her genetics is. If she's not there, I can't use her. So it's critical. And then the other thing that the research, a lot of that colostrum research kind of quits at 12 months of age and says that that's where that effect quits. But when we look at the illness rates in neonatal calves, we can see data that shows that if those calves suffer from scours or suffer from pneumonia in that first 6 months of life, they are likely to be less productive over the length of their lifespan, regardless of whether they're steers going to the feedlot or heifers going to a reproductive pool, if they had that bout of illness early in life. So again, right? Think about those calves that you bring in with scours or those calves that you treat for pneumonia, right? We don't expect them to weigh as much when we wean them. If they're a heifer, that means they're less likely to hit a pubertal age weight or weight range by the time they're an acceptable age. All of those things contribute. So critical piece of the puzzle that while not a vaccine, I think really needs to be talked about when we talk about lifetime immunity in these cow herds. And we'll come back to this and touch on it when we get to the cow side, because there's some important considerations there as well. I sure can. Ooh, that's much louder. Sorry, guys. Thanks, dear. Okay, so moving on to calfhood vaccination, right? So what are we doing while those calves are at the side of cow? Those heifers are going through the weaning process that can set them up for success in the reproductive herd. And this, again, colostrum is our first foundation. These vaccination protocols are our first opportunity to build momentum towards that immune resiliency, right? How many of you read the label on your branding vaccine and compared it to your breeding season vaccine? Anybody do that? Am I the only nerd? I see a few hands, right? So what you probably noticed is that most of those isolates are really similar, right? When we're talking about viral isolates, a lot of the stuff shows up. So this is the first chance that those calves have to see those antigens that we want them to be resilient towards for the rest of their life. For most operations, right, when we think about our traditional flow of cattle, this is an opportunity to get 2 or 3 vaccination episodes into those calves before we even think about whether they're going to make the breeding pool or not. Okay, so another paradigm that I think is important to challenge that's out there is that we don't have to worry about vaccine response rate. And there's some good data out there on the feedlot side that says that when we vaccinate cattle, our vaccine response rate is not what we would like it to be, right? We all know that the approval, they have to meet a certain range of efficacy to make approval. But then when that hits the real world, right, when we vaccinate calves that are stressed, right, when we wean calves and vaccinate them the next day, we don't necessarily get the vaccine response that we would like. In fact, there's data on the feedlot and stocker calves that show vaccine response rates can be as low as 60% in some groups of calves. What does that mean for us as a reproductive management decision maker? What that means is that if you are vaccinating calves at weaning, and that's the first time they see a vaccine, and they are stressed and they don't respond, when you do that pre-breeding vaccine, that may be their first functional vaccination. And so that's very different thing. Those calves have been vaccinated at branding and responded, boosted at weaning and responded, and then boosted again as they go into the reproductive pool. So keep that in mind that we really do have to think about individual vaccine response rates. When do we vaccinate? What animals do we vaccinate? Are they stressed? Are they nutritionally compromised? All of those things, if we want to really hang our hat on the fact that a vaccine episode is actually an effective vaccination. Okay, so pre-vaccines in those heifers, as we're thinking about where most people start thinking about how do we set these up for lifetime success, this is where we think about transitioning into those traditional reproductive vaccines, right? So your viral three-way with your VL5 component, right? Understand that even though they've seen those viral components potentially as F, we are now adding that VL component. It's going to be their first opportunity to be immunized for that component. I did not go down the trail. I started to look at lepto vaccination. You know, we all include that. That's all part of the VL5, right? Understand that lepto component has some real challenges for duration of immunity. In fact, if you talk to our dairy colleagues, right, they vaccinate for lepto really routinely because they understand that we don't get long-lasting protection. So that's something to keep in mind when we're talking about how we need to approach vaccination timing as we move these heifers from our development phase into our cow phase. I want to throw out, just because of the region we're in, I want to touch on brucellosis vaccination, right? Official calf vaccination. How many folks in the room vaccinate their heifers? Bags vaccinate, brucellosis vaccinate. Okay. I expected it to be pretty hot here. This vaccine has some real repercussions, right? There's a reason that we do not want to push the envelope on how close to breeding can we do this. Hello, there it went. Okay. Obviously, right, we're limited legally to doing it under 12 months of age. This is the one vaccine that you can't pick up at the co-op store, right, and do yourself. The vet has to do it. But understand that this is, it sets up some real nasty inflammatory processes. It can really be a detriment to conception rates if we push the envelope on it. And it is an effective abortifacient if you have bred heifers already in the population that accidentally get vaccinated with it. So this is one of those where thinking ahead, don't put this in the bucket to do with your pre-breeding vaccination if you can help it. Maybe back this one up to like that weaning or post-weaning phase, just to make sure we give those gals enough time to respond to the vaccine, clear that inflammatory process, and safely move through that vaccination process. Okay, so moving on to the cow component of reproductive vaccination, few things I think about: vaccine type, right? We touched on modified live versus vaccination timing, and what does that look like in your operation and under your logistics, and what are your goals for vaccination, right? And there can be some differences in goals across production types depending on what you're interested in. So vaccination type, going back to that modified live versus that killed vaccine, the important thing I think to remember with those modified live vaccines is in a naive animal, they set up an inflammatory process. And that inflammatory process will cause abortions in bred cows. It's really disheartening to have that conversation with a producer that maybe purchased cows and then put them right on their modified live program, or had bred cows that they didn't appreciate why they shouldn't use a modified live, come in and talk to me about the abortion storm they're going through subsequent to that, and really I don't have much to tell them. There's not a good way to solve that problem other than you're going to have really a couple questions about vaccine history in those animals. What have you done in the past? What do you expect their history to be? Could have headed all that off with a couple questions and a phone call. So modified live vaccines are a great tool, but certainly make sure that we respect them for what they are, and the potential damage they can do on the spot. So again, not 100% without risk. Generally speaking, when you start talking to folks, we reach modified lives in programs because, again, going back to that more quote unquote natural exposure type, natural immune response, we expect these to have a different and more robust immune response from the standpoint of it looks like a natural infection. So that's why those show up in protocols and the goal of that. The flip side of that is killed vaccines, right? So if you are a person that's purchasing bred cows and adding them, or purchasing bred heifers where you don't have 100% ironclad confidence in what they have had before, your safest option, if you want to vaccinate bred cows, is to reach for that killed vaccine. There is some research out there out of Auburn that did a really nice project to see what happens when we start with a modified live and transition to a killed vaccine. And there is some opportunity there for folks that need to do that. So all things that are on the table for conversation as you are designing a protocol that fits your needs. All right, this is their one, and this kind of goes back to that phone call I get when folks have used a modified live in a point where it gives them a problem, is why it should be simple, otherwise it wouldn't be OTC, right? I couldn't, if it can cause so much damage, why can I swing into the co-op and pick them up? Understand that OTC and prescriptions in our products isn't reflective of the safety of that product or the knowledge that we need to implement it safely, or the protocol design complexities, right? That's a whole different approach when we talk about how things become OTC or prescription. So it is critical to think about all of your cow herd management and how you're approaching that, all your associated health, potentially your biosecurity risks. What are you specifically at risk for before we reach for a vaccine? Outside expertise is useful, right? Excuse me. Put in that shameless plug of, if you're in doubt, call your herd veterinarian. They know your risk factors. They know your biosecurity, hopefully. They understand what your herd decision-making approach needs to be. All right, so timing is the next thing that I really think about with cow herd. Excuse me. So really when we talk about cow herds, right, logistics of how those cattle flow become one of the big questions. Can we handle those cows and get them vaccinated when they're open? In many of our systems, that's not a realistic expectation. So we may be committed to vaccinating those cows during gestation if we want to get that annual vaccination in there. Obviously, if we can do that when they're open, utilizing modified lives becomes much safer, right? We don't have that risk of gestational loss if they aren't gestating. There are some research out there that actually says that in those cows that have been well vaccinated, that we can safely use modified lives at the time of breeding if we're running them through a sync protocol. So that's out there as well and on the table. Mid-gestation is where we see most folks pick up vaccination, right? That works into our system. We're often at a preg checking event. So thinking about how we use that modified live before. Is it in our heifer development protocol? What does that look like? Are we on label with that modified live? We can't switch brands even. So understand that. We are committed. to the protocol if we want to utilize that modified live during gestation. The other thing to think about and I said we'd come back to colostrum, that viral vaccination in mid-gestation, a lot of our preg check times precipitates an antibody rise that's at an ideal time for clostrogenesis or formation of colostrum. So that's a component as well as we think about not just what can we do for this cow, but maybe there's some benefit to that calf as we make those decisions. I'm sorry, my son brought home the human variety of BRD from high school this weekend, so we're all weathering that. Okay, so vaccination goals ultimately, right? Like I said, different production systems are going to have different goals, right? We'd all love to do all things well, but really, when it comes down to it, who are you interested in protecting? Are you interested in protecting that cow from infection? Are we interested in protecting her ability to conceive? Are we interested in protecting that pregnancy once it's established, right? Is that our risk factor in our system that we are most interested in managing? Are you interested in protecting that fetus, right? Do you have a neighbor that brings in stalker calves during gestation and is across the fence from you? Maybe we need protection from BVD in order to do that. And then again, back to that colostrum piece, are we trying to put pieces of the puzzle together to protect that newborn calf, make sure we're transferring excellent colostrum to them, and putting that in play as well. So obviously we're going to do components of all these things with our vaccination program, but if we need to prioritize one or the other based on what are our goals for our production system, we may need to think about some things a little differently. All right, another quick detour, mostly from hard-won, unfortunate experiences. Where do scour vaccines fit into our herd protocol? And the reason I put this in as an important piece of reproductive efficiency is because generally these are our late gestation vaccines. We want them in about 6 to 8 weeks, depending on the vaccine type, before the due date so that we can build that colostrum, right? We have to get that colostrum built, and then we have to make sure the calf consumes it in order for these vaccines to work. Generally, these are heavily adjuvanted vaccines. Oftentimes, they're oil-based. Any of you folks that have used any of the common brands, right, you know that they tend to be pretty challenging to syringe, things like that. I want to throw out there just for awareness sake, because I see increasing research into vitamin A levels and vitamin A supplementation in beef cows, that we're a whole lot more interest in using like your EA and D injections to try and bolster those vitamin A levels potentially. There is sporadic there. This is actually a project that I worked on as an undergrad to try and replicate this, but we have seen adverse events with some of these scour vaccines, and I would say it's independent of brand. I used to say that it tends to follow certain brands, but I've seen it with most of the major brands, so I can't say that anymore. With concurrent injection of EA and D supplementation at the same time in late gestation. The reason I bucket this with reproductive efficiency is if you have cows that go down, or you have cows that abort calves because of these adverse events, right? That's the definition of inefficiency. We've taken that cow all the way to late gestation, and she's either not going to have a calf for us, or she may leave the herd really through the rendering truck in a lot of these situations. So I want to throw that out there just for awareness. Be aware that, and a lot of times what I'm seeing is again, we're heading into the co-op and we're picking up both these products, and they're great and they're important in that management. But when we put them together, it can be a recipe for disaster. Just to be aware of that. The common story I get, even when I have practitioners call wanting help with these cases, is we just didn't know. So this is my chance to get that out there. All right, so quick summary conclusion. Hopefully stimulated some thought. Hopefully to look at your reproductive vaccine differently. But vaccination in our reproductive pool needs to be approached in a thoughtful and deliberate manner, and it starts at birth. Timing, previous history, production goals, all of these things input in there, biosecurity and your specific unique risks as a production unit all factor into how we're going to design those vaccine programs. And that the goal of reproductive vaccination, while we often think that it's just like this one point in time where we're protecting this one pregnancy, let's look at it more as an ability to develop some lifelong resiliency in our cow herd. And hopefully our goal is that you will never know if your vaccination program doesn't work, right? That's the challenge of vaccine program design is if I'm not hearing anything, if I'm not seeing any disasters, that means hopefully we're doing a good job, but it's really hard to know. So let's take any questions.